We have run what we call formative study through our cooperation with Economic Policy Research Center and Makerere University. At the moment, the most recent national survey, women and girls spend 7 hours per day on unpaid care work compared to men who are spending 5 hours.
Unpaid care work is a segment which really affects women and girls, and also children in Ethiopia.
We are doing some kind of action research where we have an intervention which we implement amongst the rural women in Rwanda, and then an evaluation.
So we've chosen to focus on the culture policy, which is currently before Cabinet. We think that this culture policy provides us an opportunity to begin the conversation on paid care work, and especially bringing on board cultural institutions and also religious institutions. One thing that was found during the scoping study is that there are deeply ingrained religious and cultural practices and norms that underpin the unpaid care work that we see out there in communities.
We are aiming at changing the prevalent norms about unpaid care work. Over 70% or 80% of that work has been predominantly assigned to women, keeping them out of the market, keeping them busy in their homes, and denying them the opportunity to engage in economic activities.
It is unfair in terms of division of labor between women and men, because women spend at least 4 times more than men in terms of engaging or participating in domestic activity, in most cases unpaid and also undervalued.
This hindered them to participate effectively in income-generating activities and in leadership in their community, which are some of the principles of gender equality. Women have to participate on all activities of the country.
COVID was a huge shock, and some of them lost businesses. Some of the data that we've seen now has shown that some women lost businesses, closed permanently. Some of them got into debt, which they haven't been able to recover from. But more importantly, the childcare burden, because schools were closed, was much more disproportionate on women and girl children.
Children are affected, especially children under the age of 6, which is a very critical period for a child to develop.
Now, for these children 0 to 3 years, they don't really have a responsible department that can take care of their needs, especially in the childcare sector. So Department of Health and Education sort of removed themselves from that equation. And we had to have a series of engagements with the other departments.
So we need to have affordable, safe, and quality childcare center for children to be taken care of. However, in the context of our country, it's really lacking. We don't really have national data in that area, but a study conducted in the African continent showed that unmet need for childcare is about 80%.
Our project is about women who work in markets accessing parenting care services. I did not expect to find the things that women are doing to smuggle their children into markets against the rules of the market. But these women, faced with limited choice where to leave their children, have to bring in the kids. And when they bring them in, they have to hide them. Some hide them in boxes, some tie them to certain objects so they don't move. They are restricted, and sometimes they even get harm as they are being hidden. But also, the accidents that the children face while in markets are also horrendous. There's also using older children. Many times they are also girls, but in that case, it may limit the time they have to go to school. So that also becomes a problem now to the older girl or whoever is supposed to be taking care of the kids.
I want to give you an example. I was working. It was very challenging for me to be at work at 8 and leave at 5. Quite often you find yourself running out of office, but your boss is expecting results from you.
One of the intervention to have sustainable solution for the problem is to have effective community-based child care services.
We had an earlier project under the GROW Consortium, which was carried out in Nairobi, and building on that earlier work that we did, we set up a new partnership with the GROW East Africa, just to look at a different aspect of the work, but also looking at childcare facilities and services.
GROW was looking at the effectiveness of the Kidogo project, basically in offering quality care for women. And as a result, women have, we are able to strengthen their capabilities to participate actively in paid care work.
Kidogo model has come, I can say, it is a timely organization that has come to assist us on our strategic objective under social protection, which is under child care daycare centers.
We have seen the work that they have done in improving the quality of childcare services. We have seen that it works. We have seen improvements in children's outcomes. For instance, in some of the facilities, they were reporting high levels of malnutrition, but we are seeing children's nutritional status being improved through the quality improvement support that Kidogo model provides. We have seen also women, the childcare providers, reporting that they're better able to manage finances.
What I want to see with this is that every child, wherever they are, regardless of their lot in life, whether they are a rich child, a poor child, they have good quality care that shapes them, that nurtures them into becoming productive human lives.
Childcare is something that is not a given, but a right for them to have, and government should come in actively in this sector.
We need to see that government does smart investments. Those smart investments that can really help and support women in terms of reducing their unpaid care work. So we are utilizing research to define unpaid care work, to assess the impact of unpaid care work, also look into the future. How do we redistribute unpaid care work? How do we reward the persons that are taking unpaid care work? And of course, how do we ensure that within the policy framework, unpaid care work is recognized and the deliberate interventions by government financed to ensure that the burden on women is reduced.
We are now in the process of developing as a county. We have got a bill in the county assembly, daycare center bill. Through the initiative of Kidogo, we are reviewing that bill to improve on maybe 1 or 2 gray areas before it is being escalated and ascended as an act of the county.
Engagement with the county is very important because they're the ones who will move the work to other areas, expand it to other areas, and also ensure the sustainability of the work that we're carrying out.
And for the government to allocate a space for children under the age of 3 for a childcare center, it means a lot. And so they've been, supporting, this project and supporting their activities because they kind of understand that, early childhood development is important. And at the same time, women economic empowerment is also important. But we don't want to, just stop at a local level. We want to increase that, at a regional level and also at a federal level, for this success, to be sure.
So as a project, we want to strategize ourselves to make sure that we can be able to be part of the review, to be able to share our findings, and they shape the review that is going on. We need to really study our culture, values and norms, really reinforce those that are positive, and then change the negative cultures.
if we are going to achieve development.
We are taking the findings to the policymakers, to the parliament, to make sure that after we finish the project, we can get assured funding during the resource allocation, and your budget allocate funding for initiatives to reduce and redistribute unpaid care work.
To improve economic well-being of women, there has to be appropriate policy in place.